Hello and welcome to my presentation on LGBT and healthcare by Mackenzie Bassett from Lewis Clark State College. So before we delve in too much, I'd like you to look at why this topic is important and why you should be listening. Well, within our community, it's evident that the LGBT is growing. Their culture is on the rise. So I also wanted to note that lesbian, gays, bisexuals, and transgenders have historically and continue today to encounter barriers to accessing health services. This has been attributed to well-documented heterosexism, homophobia, biphobia, and transphobia, and it shapes all health and social institutions, according to Judith A. McDonnell, RN, PhD, Associate Professor of the School of Nursing at York University. Here's a photo I took of the 2018 LGBT rally here in Idaho. I wanted to include this in my presentation so that you could see just how many members there are of this culture here in Idaho. So what are the belief systems of the group? In order to get started, I think we should define what LGBT stands for. L is for lesbian, women who like women. G for gays, men who like men. B is for bisexual, male or females that like both male and females, and transgender are those who feel like they were born in the wrong body, so they may have been given a penis or a vagina, yet they feel like the opposite sex. I think it's also important to note that the members I have seen in the community, their biggest belief is that love is love, and people should be able to love whom they want. And not just to love who they want, but to be treated as equals as the heterosexuals in our community. In 2015, PhD student Jeremy Gibbs stated that members of the LGBT community experienced much higher rates of distress and abuse. He also found that many of them were greater risk for victimization and bullying than their peers. Many of them had suicidal ideation, participated in self-harm, had mental illnesses, and were at higher rates of behavioral issues in general. I think it's important to note this when you're providing care to a member of the LGBT community. Therapeutic communication with the members of the LGBT community is just as important as therapeutic communication with any other members of any other community. Many of them may feel hesitant to discuss their personal information, especially sexual information, as said by Manzer in 2018. The reasoning is that many of them feel as though they've been judged in the past and that they'll be judged in the future by you. Many of the members are just seeking to be heard and want someone that can listen to them without that type of judgment. And it's important to note that many of them can tell when you're uncomfortable. So the more comfortable they are, the more comfortable you are, the more comfortable they are, and vice versa. They also stated in a research study that many of them felt as though providers were trying to be too culturally sensitive. Instead of just speaking to them as normal humans, they could tell that they were trying to use the right wording and were very uncomfortable with it. When in doubt, just ask. What do you like to be called? Is this your wife? Is this your husband? In the study, it was also shown that the MPs that were being asked were very uncertain with the appropriate terminology that should be used when caring with the members of the community. This uncertainty is what a lot of the patients perceived as a potential barrier to the therapeutic communication. They felt like they were being too mindful of the delivery of the message, and it was distracting from the actual meaningful process of the content of the communication itself. The more we learn about the LGBT community, the more comfortable we'll feel, and the better communication we'll have overall. The family structure for members of the LGBT community varies largely. In adolescence, the patient's sexuality may or not be accepted at home. This really determines on whether or not they're close to their family or whether they feel isolated and may seek to go elsewhere. As an adult, extended families are often more accepting because they have gotten past the thoughts of their child being bullied and have a lot of times come to the conclusion that they are who they are. Fertility issues may cause a strain in the partnership that they're in. Sometimes the couple will decide to adopt. Other times they'll go through fertility measures. But often the entrance of a new child in general may cause the family to become closer. Because a lot of times one issue that they say is they've lost their hope for a grandchild or a niece or nephew or whatever it may be. Many LGBT members do not believe in God. Many of them feel unaccepted by Christians because of their use of the Bible against them. Suicidal ideation is common in this group because of the difference in ideologies between their cultural group and their religion. And basically what this means is that they may believe in God and they may believe in the Bible, but they've been told by pastors or readings that they're not natural. Teaching LGBT community members is just as big of a part or job as it is teaching heterosexual members. It's important to teach them the mental health resources, especially since they have had increased numbers of mental health issues. This includes letting them know the resources that are out there and what's normal and what's not. STD prevention is also extremely important, as AIDS prevalence and other STDs is extremely common within the LGBT community. And also, they may not feel like, especially in adolescence, they can get that information at home. And then it's also important to let them know their rights as healthcare participants. They should not be discriminated within the healthcare place, and they should know what their rights are when it comes to discrimination. Thank you for taking the time to listen to this presentation on LGBT and healthcare. I hope that you continue to learn more about the culture of the LGBT community and all the cultures in general.